The MASTR retractor comes with 6 retractor arms, 2 number 1s, 2 number 2s, and 2 number 3s. The number on the retractor arm corresponds with the suggested position of use printed on the base of number 1, number 2, and number 3. The retractor is prepared by placing the number 1 retractor arms in position. Number 1 retractor arm at the 12 o'clock position is advanced to the first hole, the gross placement. The locking tab is then lifted and the retractor arm is advanced to leave 3 holes showing inside the base. The 6 o'clock retractor arm is then put into place by lifting the locking tab and advancing till 4 holes are showing inside the base. Once the incision is made in the patient's neck, the retractor, 12 o'clock number 1 retractor arm, catches the upper part of the incision, is guided down and seated on the patient's neck. The lower part of the incision, the lower flap, is then guided under the 6 o'clock number 1 position. The retractor arm locking tab is lifted and advanced to keep your incision open. The avascular plane separating the right and left strap muscles is then located. Once located, the strap muscles are dissected from the thyroid and all the avascular attachments are cleared. Once the strap muscles are free, the number 2 retractor arm comes into play, catching the strap muscles, guided into the base. The locking tab is lifted and they are sequestered laterally. At that point, either the lower pole can be resected or you can continue to sequester the rest of the strap muscles laterally by placing the number 3 retractor arm in place. Catching the strap muscles, guiding it into the base, lifting the locking tab, and advancing. Locking those strap muscles laterally. The number 3 retractor arm was specifically designed to provide exposure of the thyroid upper pole and provide an operative window for the surgeon to work with, and actually shifts the tissue off the trachea a little bit laterally, allowing for an easier resection. Once the resection is complete, the locking tab is lifted, the retractor arm is removed. Once the retractor arms are removed, the strap muscles should fall back somewhat into the normal anatomic position. They can then be reapproximated with suture. Once reapproximated, the lower 6 o'clock number 1 retractor arm locking tab is lifted, the retractor arm is pulled back from the retractor, releases the lower part of the incision. The retractor is then guided downward and upward to release the upper incision pole. The platysma and skin can then be closed. When you work with patients that are particularly large or have a lot of tissue, the number 1 retractor arms can be substituted with a number 2 retractor arm for, as you can see, a deeper muscle purchase. Each retractor arm has stopping tabs 1 centimeter from the end to prevent tissue entrapment between the retractor arm and the base. All edges are rounded and atraumatic to the patient. We sincerely hope you enjoy using the MASTR and your patients benefit from an atraumatic thyroidectomy procedure.